Hello, my name is Ramsey Awad. I'm the Executive Director of Infrastructure Planning and, most importantly, Sustainability. I work for an organisation called Hunter New England Health Service. We are based in the city of Newcastle, which is a wonderful coastal city on the eastern coast of Australia, about a 2 hour drive north of Sydney. And we're really honoured to be here today to share some of our initiatives and some of our successes. Let me tell you about Hunter New England Health. Hunter New England Health, unlike the US, but similar to Canada and UK, are a public health service. We are the largest health service in the state of New South Wales. Our geographical area is the size of England. We're also the largest employer in this region with about 20 to 25,000 employees. And we've got 120 facilities, lots and lots of infrastructure across our health service, and our operating budget's around the 2.5, creeping up to 3 billion next year. And we're also proud to say that we have the busiest emergency department in the state, which is really hard work, but it's a dedication to the good work that we do here at Hunter New England Health. So it gives you a sense of what we're operating in terms of environment. Now, we made a decision to adopt a green vision, and that green vision had a number of components. The first is that we would be carbon and waste neutral by 2030. Now, the waste piece, as you're all aware, is the trickiest of those measures, but we wanted to be bold and we wanted to come out very hard in this space and become leaders in this space, which is what I hope and I think we've achieved over the last few years. The second part of our vision is not to be zealots about sustainability. There is a tension, which you're all aware of, regarding the spend of the very, very tight health dollar. And we never wanted to set up a dynamic where we couldn't spend money on frontline clinical staff because we'd spent it on solar panels or sustainability initiatives. So what we've ensured is that every single one of our strategies is cost neutral, and the vast majority save money that can be reinvested into frontline clinical services. And this is a really important dynamic which has led to a lot of success and no tension with clinical staff. The third part of our vision is, and I mentioned in my introduction, we are the biggest employer in this region. We have the opportunity to drive change in our market in terms of what we purchase, but also to demonstrate leadership in this space for other organisations beyond the health environment. Why are we doing this? People in this room will understand why. We know the World Health Organization statistics around 25% of human disease being attributed to global warming, and that being 36% with children. But particularly in Australia, we have been feeling the brunt, as I know many countries have, on global warming. We have, on top of COVID, had severe droughts, we've had flooding, we've had bushfires, and these things occur more and more regularly. And in Australia, our CO2 emissions from the provision of healthcare is about 7%. We are the largest emitter out of any of the government agencies that exist in Australia. So our board made a decision that if we genuinely are here to care for our patients, then we need to care for our planet, which led us to the mantra that we need to be able to say as an organisation that we do no harm. So that's why we're here, and I'm sure all of you are here for similar reasons. Now, we have a formula. How do we achieve the things that we achieve? There's lots of initiatives that we could share with you, but I thought today we'd just share what our secret sauce is. This is change management, and you have to win the hearts and minds of people to ensure that things are A, implemented, and B, sustained. So there are 9 elements to that, and I'll just walk you through quickly each one of those. One is presenting a case for change, explaining to our community and staff why we're doing this, and we've done that through a number of different vehicles, be it websites, videos, articles. We establish goals that we want to achieve, and we put timelines against those goals. Then we set specific performance measures, and we work towards them, and we have yearly targets that I'll share with you, and we commit as an organisation to hit those targets, and I'll show you how well we've done in the last few slides. The next three elements is it's well and good to have performance measures and targets, but you need a simple way to collect the data and to report it. So it's very digestible, and it doesn't take a year to collect the data to see how you're progressing. So we've spent a lot of time establishing good data collection and reporting processes. We establish governance. We have governance which cascades down from the board all the way through to the organisation, which focuses on sustainability. We reward and promote excellence. So people that are doing great jobs, we have sustainability awards now that, and people are recognised for their good work in this particular space. We also establish communities of interest where like-minded people are coming together to share ideas, share knowledge. We have established communities of interest within our own organisation. There's about 30 groups that are running small sustainability projects in their areas of operating theatres or loading docks or in HR, but we're also part of broader communities of interest across the world where we are stealing ideas and trying to implement it. We manage and share our knowledge. We take good ideas and we share it with the rest of the organisation and other parts of the industry. And finally, we provide leadership. I'm the only executive in New South Wales Health with sustainability in their title. You need executive leadership in this space because particularly in government organisation, there is a lot of bureaucracy that exists, particularly at the middle management level, and you need to be able to cut through that, and having an executive responsible for that is fundamental. So we focus on 6 key areas: energy, water, transport, infrastructure, procurement and waste, and there's a myriad of wonderful projects that we are doing underneath each one of those headings. But I wanted to share with you our performance in the last 2 years since we've started. So we've got a baseline for our CO2 emissions. It's close to 100,000 tonnes. We set our target of 20% decrease for year 2, and we're actually able to achieve a 24% decrease, which is great. We set a target of capturing every bit of rain that falls on a Hunter New England roof. We only did that at 5% of occasions. We set a target of 20%, and we're actually achieving 29% now. We set a target for recycling and reusing water. We've had some amazing gains in capturing RO water for renal dialysis and using it to just simply flush our toilets. We had a baseline of 1%. We wanted a 20% increase, and we were able to achieve 23% in our second year. And finally, the hardest, waste going to landfill. 92% of our waste goes to landfill. We wanted a 20% decrease. Unfortunately, we didn't hit our target, and you all know why, because it's tricky. We were only able to achieve 14%. One of the large initiatives that we've been able to roll out is putting solar panels on every single one of our facilities, and we in fact have the largest solar installation in the world on a hospital at the John Hunter Hospital, which is in Newcastle. And in the 12 months since it's been open, we've planted the equivalent of 55,000 trees, which is a great figure for us. And finally, this myth around sustainability costing more money. We, in the first 2 years now, have saved about $2.2 million by those initiatives, and that's without the large solar installation kicking in. And that money is reinvested into frontline clinical services, which dispels any myth or rumour regarding this being a expensive exercise. Thank you all for your time and for hearing us out, and I hope that we can continue to share our successes here at Hunter New England. Thank you.